Hi guys, this is Dr. T, and welcome to Clinical Medicine with Dr. T. So guys, today's episode, we're going to be talking about peptic ulcers. Obviously, this is a surgical topic, but surprisingly enough, as much as it's a surgical topic, so we talk about peptic ulcers when we do surgery. But what I've realized is that by the time a patient becomes a surgical patient, by the time a patient with peptic ulcers, by the time they become a surgical patient, it's when they've got complications. As long as there is no complications, they are relatively not a surgical patient. They are seen by GPs, they are seen by casualty, and all of that. They are seen by the physicians and all of that. You can refer them to surgery when they've got complications or when you want to do an endoscopy, upper GI endoscopy. So as long as they don't have complications, they remain medical patients, if I may put it that way. So peptic ulcer disease, also known as PUD, very common, very common, because of a lot of things, lifestyle and things that we consume, and then all of that. So guys, I'm not gonna be doing epidemiology, all those things, ne? I'm just gonna go straight and talk about let's talk about the normal physiology first. So remember, we have a stomach like that. So in the stomach we have about 4 layers. So the layers that make up the wall of our GI, the first one is the mucosa, made up by the epithelial cells, and the submucosa. Then the muscle, or the muscularis, and the serosa. Muscularis. So these are the layers that make up the stomach, or the GI wall. So remember, this is like we have zoomed into this. It's like, let me do it this way. It's like we have enlarged this part and made it bigger, like that. So this is our innermost layer. This is the layer that is exposed to HCl. It's exposed to hydrochloric acid and pepsin. So we have got factors that are protective, that protects this wall, and we've got factors that can aggravate, can actually go on and cause ulcers. So we'll call these ones aggravating factors, and then we'll call the ones that protect defensive or defense mechanisms. Right? Okay. I wonder where's my pink marker. Anyway. So when you have a good balance between the aggravating factors and the defense mechanisms, you are unlikely to develop ulcers. Maybe we should talk about what's an ulcer. The definition of an ulcer. An ulcer is a defect in the wall of the stomach that extends, very important, it extends to the muscle, to the muscularis. Ne? So this means that if you have an ulcer, for us to say you've got an ulcer, it means that you must have a defect that starts at the mucosal layer and wipes it out in that localized area and extends to the submucosa into the muscle. So it's going to be something like this. So now that's an ulcer. As long as these layers are not penetrated to the muscularis, then it's not an ulcer. This is where we speak about gastritis. With gastritis, you might have mucosa that is eroded, or submucosa that is also eroded, that is inflamed, but you don't really, but there is no defect that extends to the muscle. Then it's not an ulcer, it's just gastritis. Okay. So the factors that aggravate or cause ulcers, the number one culprit is H. pylori infection. H. pylori, which is a bacteria, gram-negative bacteria. Number two, NSAIDs. Things like brufen, aspirin, diclofenac. There are so many, guys. There are so many. The most common are these three. There are so many others. Mefanic acid is one of them. There are so many of them. Other aggravating factors: smoking. Smoking is even worse. Smoking, some articles say that doesn't really is not a main factor in terms of initiating an ulcer, but when it's there, it impairs the healing. Some says there's also an element of it causing hypersecretion of the acid as well. But yeah, that's a plus minus. What else? So maybe I should have just put lifestyle. Some say caffeine consumption. I mean, there are people when they take something with caffeine, they start having dyspepsia. So it's true, it does cause it. We cannot leave out alcohol, right? And when it comes to and then we cannot leave also hypersecreted state. Like Zollinger-Ellison syndrome. Zollinger-Ellison. So with Zollinger-Ellison syndrome, basically it's a tumor that is in the stomach that is secreting a lot of acid. And then there's things like MEN1, multiple endocrine neoplasm, things like that. Now, when you talk about, these are the factors that can cause an ulcer. So, but we have got defense mechanisms. The first one is we have the important thing is that you want to have this acid in the cavity, like in the stomach cavity. You don't want it to penetrate inside the layer. So you've got the mucosa is the first defense. That's the first one. The second one is the bicarb that and the mucus. So there's a mucus that is secreted, a thin layer of mucus like a gel-like that is secreted along the wall. It prevents the acid and the pepsin from penetrating into the mucosa. That's the mucus layer. And then obviously this is a base. So it also is also secreted along the wall here. So that the acid that tries to penetrate will be neutralized. So you have that. And obviously you've got the mucosa as the first defense. The other thing is the prostaglandin. Prostaglandin, the E type. Prostaglandin E. So these are your defense. So these their main job is they play a role in the production and the secretion of bicarbonate and also in the formation of the mucus. So these are your defense. These are our defense mechanisms. The minute you have, let's say you have one of these attacking or trying to cause an ulcer, these will be stimulated to try and prevent. But if it's severe enough, it will eventually, so you're gonna get an imbalance. So you want to maintain a balance here, a balance like that. The minute these are your aggravating factors, these are your defense mechanisms. The minute this is imbalanced, you get like something like this. So your stressors, they are a lot than your defense. Then it means there's an imbalance. So you are gonna develop ulceration there. So you want to keep these like that. So prolonged use of alcohol, caffeine, NSAIDs, and a continuing H. pylori infection will eventually overcome this and deplete these, and then you end up getting an ulcer. So these are your causes basically, right? So as we all know that there are two types of ulcers. You can have a gastric ulcer. It can be gastric or it can be duodenal. I'm not gonna get into the details of each of them, but a duodenal ulcer is usually in the first and the second part of the duodenum, around here. This ulcer is a main culprit in terms of gastric outlet obstruction which is a complication. When you've got a duodenal ulcer that is here, you keep injuring this. You remember, anything that keeps being damaged, when it heals and form a scar and becomes fibrotic. Once this becomes fibrotic, it cannot be elastic anymore. So at some point, the patient will just present with the gastric outlet obstruction, which is a complication of a duodenal ulcer. And then the other one is a gastric ulcer, which is in the stomach. This one is known to cause, is a risk factor for a gastric carcinoma. So basically things like, but remember, we're not registrars, but at the reg level, you need to go deep in terms of gastric ulcers, because the risk factors for gastric ulcers are not really the same as the duodenal ulcers. They've got their own, but we're not at that level where we should be worried about those things. For us, this is what we need to know. Okay, so now we know what an ulcer is, we know the types of ulcers, we know the causes of the ulcers. These are very, very common, guys. The most common culprits when it comes to ulcers is these two. It's so unfortunate, but according to what I know and what I've seen, these are the main problems. Alcohol, because remember, someone who takes alcohol, they develop gastritis. and then they keep drinking, and then they develop ulcers. So according to what I know, these are the two most common causes. The thing is, with H. pylori, we hardly test for H. pylori, so we cannot say it's there, but literature says that it's the number one cause, depending also where you are in the country, where you are in the world, where you are, the prevalence of H. pylori infection, right? So let's meet on part 2, guys, so that we can have short videos. Let's meet on part 2 of this. Thank you.